US is really an unfair healthcare system animal, isn't it? Because it's a money machine, isn't it? What I see in US is a very fragmented healthcare system, too much money involved and too many interests. I mean, the supply chain sometimes it could be like six or seven people making money until the patient gets treated, which is crazy.
Ladies and gentlemen, welcome back to another fabulous episode of the HealthCare Trailblazers podcast. Excited to be sitting here today with the wonderful Joao Bocas, who is the first and number one digital health influencer in the entire world. So let's just jump right in there. How did that come to be?
Well, Mendel, thank you so much for the invite. I'm delighted to be here with you. You know, that might cause some controversy sometimes. I claim to be the number one, but it's not about ranking for me. But I have a story attached to that. I was actually the first ever digital health influencer worldwide. I used to call myself a digital health influencer back in 2020, 2015, when I was doing a digital health startup with a friend of mine. And I had business cards with digital health influencer on it. And people used to ask me, what does that mean? It was a totally alien concept. So I believe I am the first ever digital health influencer, and that number one spot nobody can ever take off me.
So by number one, you mean first. You're
Yeah,
the OG. Okay, so how did you get into digital health influencing? What is your background? Talk to us.
yeah. Actually, my background is in professional sport, but I've been in corporate wellness also for over 15 years, and
Okay.
I've been in health for over 20 years. I have two passions. I always say, sport and health, which they go hand in hand. So I graduated in UK. I'm a Portuguese national. I came to UK in 2001, and I graduated with a sports degree. I'm actually very passionate about health and fitness and everything to do with health. And then I started working, as I mentioned, in health. And I transitioned to, by accident, to be honest with you, with healthcare technology because I was doing a startup, and technology is not really my background. It's more about performance, is more about helping people to be healthier. And things just escalated from there. I created a bit of a name online, as you know, as a profile, as an influencer, and yeah, and the rest is history. So the last 10, 12 years I've been working really hard on creating a profile, a brand on social media, on my Twitter, on my LinkedIn, and now I collaborate with companies worldwide, and I play a thought leader role, but also a connector of conversations leaders around healthcare.
That's awesome. So let's go back to your sports career. What did you play? What sport?
Soccer, football, and I
Football.
was also
Nice.
a football referee in UK, which
Oh, really?
sometimes was not a very pleasant experience, but that's a different story.
Did you want to go pro? Was that the plan?
No, I passed the stage. I was okay, but I was not very good to go pro. And I transitioned to refereeing. Refereeing really helped me a lot with my interpersonal skills,
Ah,
communication, handling conflict, um, volatile situations, anger, everything you can imagine happens on a football field. Very unpleasant things sometimes. You can't take it personal. It's just like emotions they get out of hand. But that
yep.
really helped me in terms of resilience, about communicating with people and stand by your core values. So yeah, that really helped me in life too.
You took a lot of life lessons. Wow. And so you started a startup. What was that startup that got you involved in health tech?
Oh yeah, in 2015 we have a startup called the Self Care People. We had this big ambition about creating a data analytics platform for wearables and for digital health data. Unfortunately, it didn't go very far because my co-founder was working full time and we didn't take the project forward. But then my passion for health and for digital health surfaced, and I carry on working in healthcare. And yeah, 8, 8, 9, well, 9 years later, I Yeah, I'm very active in the industry, as you well know. You found me, I found you, so we're doing something right, Mendel.
Yes, indeed. The network is fantastic. So, what do you do on the day to day? You're doing a lot of keynotes. You're showing up at different events. What do you like to talk about? What is that passion? How do you channel it?
Yeah, I think I talk about different things, but I stay in the health lane, if you like. Healthcare is my only industry at the moment. I have other ideas to do things, but I talk about wearables worldwide. I have a passion for wearable technology too, and yeah, I help brands online to get the right awareness. I believe in these days having a very strong brand and brand presence is essential. Is a very competitive space, as you know, with thousands of companies, a lot of great innovation. But you can have a great product and you can have a great technology, but if nobody knows about that, it's a bit like there's no value. So I help companies to get to be credible, to be exposed online. I connect companies with people and people with opportunities.
That's awesome. So, going talking about wearables for a minute, where do you think the future is with wearables? Where do you think wearables can make the biggest impact in healthcare?
Yeah, I've been thinking, Mendel, I've been writing articles around wearables, and every year, I stopped doing that now. Every year I thought, right, 2017 is the year of wearables, 2018, 2019, 2000, and then I stopped. The thing about wearables is the potential is enormous. You see, for example, the glucose monitoring. I mean, that is actually a direct need. You need to control your insulin, know your insulin levels, and have a direct input there. In healthcare, for one reason or another, wearables have not been able to be embedded in health systems, and there are a couple of reasons for that. One, there is no incentive at the moment. Then, um, also, who supports the cost is always a cost attached to it. And I believe we need a shift in that. But you asked me where the potential is enormous, and I think one unexploited area is preventative care. And I've been working in health for a long time, as you know, and a lot of companies mention about doing preventative care and helping employees, and is very difficult to achieve that. I believe wearables can be an excellent vehicle to really help people to monitor their health, but also to get the right type of engagement, notifications. But to start with, we need intrinsic motivation. What is your motivation to wear a wearable? Is it because you're trying to manage a long term condition, or you try to prevent, or you try to lose weight? What it is. And if the individual doesn't really engage with the wearable become obsolete, because the wearable on its own is not performing any miracles. You need the change of behavior. That's where the trick is. But going back to your question, my vision is that wearables can change the world, certainly the healthcare world. But for that, we need to support people, educate them, and also make the barriers of entering the wearable space, reduce the barriers to usage, to adoption, and some critical barriers.
I think I lost you for a sec. There you are. Um, that's awesome. So, you're not a doctor from my understanding, and yet you're extremely passionate about healthcare and about being active. Like you mentioned, you like exercise and sports, and um, I think one of the biggest issues around any healthcare system is that it feels like the responsibility for healthcare is on the doctor and not on the patient. Um, can you give some thoughts around how we can possibly change that paradigm to start putting the patient in the accountability seat? How do we get ourselves to actually get on the bandwagon of making our own health better?
Yeah, sure. I think education plays a big role there. Also, um, perceived barriers. It's perceived that healthcare is complicated and is complex and is very difficult. We have all these preconceived ideas. I think one of the things that we need to start doing to start with is to simplify things, to demystify. It's not about technology, it's not about actually the wearable itself, it's about the patient or the person engaging with the technology, engaging with the wearable. So it's a piece of work before we actually doing the connectivity with the technology that is extremely important. And then leveraging the technology as best as possible. For example, with wearables, they are great, but they're not gonna last forever. They have 5 6 days battery span. We need to um, help people to continuously use them. Simple things: charge your wearable, engage at least one meaningful piece of data that is meaningful for you. It might not be meaningful for me. I'll give you an example. A few years ago, measuring step count was um, very interesting to me. I'm not very interested in that anymore. I'm more interested in my sleep. But whatever ticks your box, yeah, and that's what actually is going to drive your motivation. So it's extremely important to ask, why am I using a wearable? How can I mostly benefit from it? So, and sometimes the simple things are missed in the complexity and the situation. And I think is a big piece of work to do to be done around that. So help people to engage the best way possible to get the best benefit possible.
Yeah. So for you personally, maybe some other people can follow suit. What was your personal journey to getting excited about healthcare? For your own. You seem still fit, and you got great energy. You bounce around. What was your personal journey to becoming passionate about your own health?
Yeah, for a number of years, Mendel, to be honest with you, I was very unhealthy. I drink a lot, and I was not very care. I didn't care much about my health, and I reached a point that I wanted to make a change. I wanted to turn my life around. I didn't want to do what I was doing. It didn't make sense to me anymore. And eventually I make that change, and I saw an extreme benefit right away for my physical well-being, mental well-being, energy, clarity of mind. And so um, being healthy for me is really the top, is my priority in life. And of course I want other things. I want the love, I want the materials, I want to be successful, I want to travel the world, I want to do all these things. But the foundation for my life is great health, you know. So my motivation, actually, I had a bit of like a personal journey intertwined with my career, which I don't talk about that quite a lot, but I have like a great personal motivation to first of all help myself and be healthy, and then help others.
Yeah, it's meaningful. Um, so if we can talk a little bit about you're living in the UK right now. You come from Portugal, is what you said. What are some of the key differences in the healthcare systems between the US and the UK?
Oh, great question. I think they both going through a difficult time and certainly a transition time. In UK, for what I experienced the last 7 8 years, and when I started doing the startup, I really experienced that some closeness to the NHS, the National Health System. We still face a lot of issues in terms of capacity, delivery, quality of delivery, but also a very fragmented health system that it doesn't do any favors to people to start with. And I'll give you an example. I live in the south coast of England. If you go to Manchester, for example, the north of England, you might not have access to your personal medical records. And we're talking about, for the perception of anyone outside the UK, a health system that is all in one, but unfortunately it isn't. And there are a couple of reasons that is very difficult to bring everything together, because different regions in a country do contracts with different providers. So, for example, In north of England, they have a contract with Oracle. In the south of England, they might have a contract with Hewlett Packard Enterprise for the data, whatever that is. So it's very difficult to bring everything together. The other thing is digitization is not a straightforward line. It's not just about bringing technology. Is a lot of other process management involved. And one thing that I've been, unfortunately, I don't want to criticize the system because I live here. I have great access to healthcare free of charge, to be honest. Uh, but we have not been great in terms of leadership to have a clear strategy of bringing everything together and making it better, because we have a lot of change of leadership. The governments change. We're still talking about issues that we're talking 8 years ago. Who owns the data? Let's have the patient sharing the data. All these things that sometimes, to be honest, Mendel, they drive me crazy because they think that we are asking 8 years ago and very little changed. So that's the wrap up in UK. I would like things to be a bit more, um, people to be more proactive, and I would like to see public health investing in prevention, in education. A while ago, we had campaigns about smoking cessation, about drinking less alcohol, about fruit intake. I like to see that. Now is nothing going on. Going to the US now. The US is really, um, how can I put it, an unfair healthcare system, animal, isn't it? Because it's like it's a money machine, isn't it? The healthcare system in the US is more about, is a very very rich industry. I think it's like 19% of the GDP of the US. Yeah, that
Or
tells the
spent.
story.
Yeah, it's definitely we definitely have a cost issue in the United States.
Yeah, yeah.
Um, and is do you not have a similar cost issue in the UK? Does the healthcare system balance itself out? Does I mean it's completely NIH is
Yeah,
everything, right? So
there is a cost issue for the taxpayer, which directly links to you individually. You pay your tax, but you pay your tax and you have free healthcare.
yeah,
Okay. Um,
but
there is
do the
definitely
taxes
an issue.
actually pay for the healthcare, or does the healthcare cost more than the taxes are bringing in for that?
I think well, you pay more tax, but the tax, they need to be distributed with other priorities too: education, the roads, maintenance, everything
Yeah.
around the country. But what I see in US is a very fragmented healthcare system, too much money involved and too many interests. I mean, the supply chain, sometimes it could be like 6 or 7 people making money until the patient gets treated. There are companies just doing, as you well know, just invoicing, which is crazy. Yeah, the company is just doing the invoices. Yeah, in UK that would be an impossible business. Yeah, because there is no invoicing to do.
Hmm.
You go to the hospital or to the doctor, is nothing to pay, is nothing to invoice, is nothing to report. Yeah, you come back home. I would like to see in US definitely a big change, and the only change that I see possible, and I have a bit of an idea, and I want to impact the healthcare in the United States, worldwide, but in the United States, is people taking responsibility for their own health, become healthier, reduce the cost, reduce the need, and don't feed into the system. Yeah,
Hmm.
that is actually the best solution possible. But for that, you need to educate people. You need to raise the delicate issues, bring that to the forefront, and eventually the big players, they will wake up and or have a bit of a shake up in their profits or whatever that means. They actually will think not just about the money but how to serve people better. But in US is definitely a big problem.
Yeah, it's really interesting because I speak to a lot of people from Europe um, about the various different healthcare systems throughout, and obviously I'm in the U.S. and very plugged into the system here, and it's interesting, and this is true throughout life, where typically in relationships, people's biggest advantages are their biggest disadvantages, and vice versa. And I think you see a similar effect in the healthcare system where just based on what you're saying, the difference between the UK and the US, it seems like there's a direct correlation at the end of the day between a high level of capitalism and even the negative effects as far as greed and people making too much money, so to speak. But there's a direct correlation between that and innovation. And in a country where that's more stagnated and you don't necessarily have those issues of people making too much money in the healthcare systems, it seems like you see that correlate with a lack of innovation in healthcare. And it's almost as though it would seem that, innovation follows greed, which would make sense from a humanistic nature perspective. What are your thoughts?
Innovation follows greed.
Yeah.
Um, I I'm not sure if I agree with that because I'm with you. Yeah, I am with you. Look, when I talk about health tech innovation, I go and look to the Nordics, Finland, Denmark, Sweden, um, Slovenia. I'll talk about see these countries. They have public health is very good there, and they have a plan, and they implement it. They give access to the startups, to the hospitals, to the pilots. The government subsidizes innovation, encourages people to get out of their jobs, start entrepreneurship careers. In US, I partially I agree with you because innovation is accessible, innovation is there, but the system is so strong that it doesn't want to absorb any change. The system doesn't want to change because of the way that is set up. Yeah, with the players, with the insurers, it's it, it's all around a vicious circle of influence. And I
I mean,
wish
there's an extremely dynamic startup culture in the healthcare space in the U.S. But let's talk about, because I'm curious. So in the Nordic countries, with the innovation that goes on there um, in the, like you said, the wearable space, the digital health space, where's the money? There has to be, and that's my point. They have to be interested. So you said the government subsidizes innovation, they give them access, but there's got to be an endpoint where people typically don't start companies if they don't feel like they don't put in the work to go through the pain of doing a startup, risking their whole life, risking their relationships, risking whatever capital they have, going out, right? They don't do all that if there's not an outsized reward on the other side. So where are these startups ending? If they're starting in the Nordic countries, but the Nordic countries would control the entire healthcare spend, which would mean that they would cap the ability to profit. Where's that
they
going?
they expand to Europe and to US, and I'll give you a couple of examples. Wearable technology from Finland, they very is a very hot country for wearables. They have the Polar, they have Sunto. The Oura Ring comes from Finland. They're very big in US now. Most of these companies they realize that, Mendel, they realize that the market is not actually big enough, there is not like dynamic enough, the government they're not going to buy wearables from them, they go to other countries, and the US is certainly very very big because you got like over 300 million people, but also they go and serve where is the need, the demand, where they can cause more, where they can cause more impact. So they end up somewhere else, expanding, of course, internationally and outside the Nordics. The Nordics is a kind of a starting point.
Yeah, and so that's definitely to what I'm coming to this realization where there's a negative connotation, especially by the Europeans, around the amount of money in healthcare in the US. And like you said, the supply chain, there's so many people making money. But at the end of the day, it would seem to me that any innovation, a lot of innovation comes out of the United States for that same reason. But even innovation that comes out of Europe or the Nordic countries is going to end in the US. And if you shut down that market and you try to make the US market look similar to the UK or to the Nordic countries or to Europe, then I think you would see a sharp decline in innovation, because then people, right now we have the advantage of looking globally and saying, okay, I can start this company in Finland and then I can end up making, $1 billion in the United States someday. But if you shut that down and everything becomes Finland, then why am I going to start this company if I'm not
Mm.
if I'm not going to get anywhere, right?
Yeah,
It's
I'm
interesting.
with you.
It's
I'm
interesting.
with you.
Yeah. we have to figure out a balance. We have to figure out a way to accomplish both objectives.
Absolutely.
It's fascinating.
Interesting
Very cool.
conversation.
So what does well, yeah, I know we only have a couple more minutes here. What does 2024 look like for you? What's in the plans?
Yeah, I'm always working on partnerships with great companies. To be honest, I move a little bit away from the early stage startups, working with more mature companies, sometimes some even well-known tech brands. I recently formed a partnership with a fairly large technology company. I'm coming to IMS. I have an interest in US. I want to be seen in US. I want to be known, and I also want to create an impact in US. So, um, yeah, I'm going to IMS. I'm also going to a few uh, European events, and also I'm on this mission that I want to attract people to like you to talk about this, the issues, the addressing what's right, what's wrong, and moving things forward and try to bring the right energy to push this agenda forward is essential. That even the World Health Organization is always talking about the great things, but things they move slow. You need more people like me and like you that they want to kind of give the big boat a push, that we need to move into a different direction. So I like talking to people, as you well know.
Love it. Well, Joao, it's an absolute pleasure to speak to you, and I wish you tremendous continued success for 2024 and beyond.
Thank you so much, Mendel. Nice to see you.